In a quiet rural community, nestled far from the pulse of modern healthcare, the story of the George Mangibo Reach Out Foundation continues to unfold. A place where access to medicine is scarce, and hope often comes in silence. But on this day, silence was broken by footsteps, by voices, by healing hands. This is the story of a medical outreach, one fueled by compassion. And quietly dedicated to a man whose memory lives on through service. The George Mangibo Reach Out Foundation had one mission: to reach the unreached. With a team of doctors, volunteers, and supplies, they set out not just to treat, but to listen. Led by vision and a heart for humanity,
Okay, we are in Georgia today to carry out free medical outreach. It covers major parts of medical practice, aside some specialty like surgery, dental, ophthalmology, but every consultation, health education, and every other thing is covered, aside the surgery and some other specialty. Okay, what we are trying to achieve is to give back to the society, which the George Mangibo Foundation is known for. We are always giving back to the society, not only in medical. We do other corporate social responsibilities that we do. So today we have come for a medical outreach to educate patients, health education, give out free drugs, mosquito nets, wrappers, and other things, just to those ones that will need it.
this outreach was designed to touch lives and heal wounds long left unattended. The town hall stood as a shell. Plain, quiet, unused. But within hours, it became a symbol of possibility. Transformed by hands that believed health shouldn't wait,
Good day. My name is David, and I'm a member of the Judge Mangibo Outreach Foundation team. And today we are in Jojama community. We are doing a medical outreach, and today we are reaching out to different communities.
Every corner told a story.
Mangibo Foundation, Judge Mangibo Foundation. Okay, I'm the lead nurse for this program. This is a reach out program to help the ones that can't easily access the healthcare. Is to get to reach out because our foundation is more of reaching out to people, the needy, to help people around. So we're trying to make them understand that we are here for them, the old people that can't go, people that cannot afford these things. We're here to tell them that from time to time we come to reach out to you, give medications where necessary, treat where necessary, diagnose and probably refer.
Scientist in charge of this foundation. The aim is you know that when you know what are the issues of people, you know how to address it, right? So that's why the lab is kept aside to assist the doctors in diagnosis. So that if we're able to discover what their problems are, then the pharmacists can do their work. Right?
My name is Ibeto Arimati, and my position basically is to assist the pharmacists in the spirit of teamwork to facilitate the process so we can effectively attend to our highly respectable and reputable mothers, fathers, youth that came for this medical outreach. It's beautiful voluntarily coming to serve humanity through this platform, and my basic expectation is for every respective patient, like I earlier said, our mothers, our fathers, and youth that is here should get the quality medical services they came here for. And very importantly, whatever is their health challenge, as we administer or dispense these drugs, let it effectively work in their system. So it's going to be a legacy, it's going to be a memory that will never be forgotten, and to all glory be to God.
They didn't just set up a clinic, they built trust, access, hope. From young children to the elderly, they came. Some walked miles. Others arrived before dawn. In their eyes, not just illness, but hope. For most, this was the first medical attention they'd received in years. The need was real.
Yes, what I saw was very, very sweet, and most of us, what we are seeing, because even the hospital we have here, most of us we didn't used to go there because we always go to chemists here to look for drugs, and inside the community here. And the way we see things and the way we get injury, and this is my leg too, the accident I have too. So, but as I saw these people that came here, I said that yeah, they came to give us this pharmacy that we saw here. That yes, I love it for me to come here to even get the drugs. For me, for this leg, should leave me, and so that I can walk through. Because of this leg, I cannot go to work. Because this leg, I cannot do anything. So long as I'm having the drugs here, let me see how the thing will be with this my leg.
I need to be here, and for me to be among these people who want to take medical. So I am very happy. Glad. It has been a long time. I've not seen it. Sometimes wishing me headache somewhere. We don't pay now, but they buy drugs on that time.
I don't go see doctor since I think last year I go do test for general hospital. As I do the test finish, test come out. When we go, we no say the man to collect the test. So since then we never go. So we won't go this ending of this month. But now, as very they know where to go. Maybe in a new month, where I go fit go collect my test.
They came slowly at first, then in waves. From every corner of the village, word had spread. Help had come. Mothers carried babies, fathers brought their hopes. Their ailments ranged from the visible to the hidden. Some came for medicine, others for answers. What was once a hall had become a lifeline.
Wow, good afternoon. It's been wonderful. As a matter of fact, I'm enjoying what I'm doing. It is a delight seeing people from these communities hearing about this and coming around to be attended to. As a matter of fact, there are so many people I have seen today that have all kinds of ailments, some on the line, others very obvious. As they're coming, you can see they're in pain, and we can't just imagine if we didn't do this, how things would have turned out. As a matter of fact, I have registered more than 180 names today. 180 names, some of whom have been seen by the doctors and given prescription drugs. Others are yet to see the doctor, but it's been wonderful. I'm enjoying it, as a matter of fact.
I mean, Obama, now this time around again, taking these whole persons who are seen on free medicals is something to actually commend. It is indeed worthy of committing. And as God will have it, the privileged in the society or in this part of the community is doing what is expected of them by giving out or reaching out to the less privileged. You can see the mammoth crowd. You can see those of them outside. You can even imagine those of them who have been here and have left this place. They have all been attended to. It has impacted so much on the people, to the extent those who cannot afford medical bills take the opportunity to take care of themselves, and today they are happy people.
Inside, the hall had come alive. Every station had a purpose: diagnosis, care, relief. Some patients had waited hours, but no one was turned away.
Finish up with the doctor now. I'm going to pharmacy. So, actually, it was BP, and at the same time, he told me that if the BP is much high, I should check my malaria and typhoid. Okay. Those are things that trigger the BP high. So I'm going to collect my drugs now.
In each encounter, respect came first. No one was just a number. For some, this was their first proper consultation in years. Every dose given, every hand held, was a step toward hope.
Yeah, sorry, doctor. Was nice.
Are we pregnant?
Yes.
How many months?
She's going to say. And they give me drugs for some sharp pain in my tummy. I'm okay with it.
They pay me or something, not they come out. Yeah, I know so. I don't say doctor, doctor don't write for me.
Okay.
I will go do them now. They take them.
Okay, well, thank you.
By the day's end, fatigue had set in, but so had fulfillment. Hundreds were seen, many more left with medication, reassurance, and relief. I told the doctor how I was feeling. Whether it is malaria, body pains. And these are the drugs he gave to me. But beyond the stethoscopes and syringes, something else had been given: dignity.
ED, as the Chief Executive Director, is to ensure that the people of this region gain access to quality health, and have access to quality medicines, because without medicines, health issues cannot, most of the health issues cannot be resolved. And here we have a lot of those benefits. People are here. I'm very sure that many people will go home today be happy. And after now, they will see the impacts of all these outreaches. Of course, we have various types of drugs here, ranging from anti-hypertensive drug, diabetes drug, antibiotics, hematinics. We have antimalarial drugs, we have analgesics, we have supplements, we have NSAIDs, we call NSAIDs, that is non-steroidal anti-inflammatory drugs, and anti-ulcer drugs, of course, are here. We have a lot of drugs here that will benefit the populace today as they come, and we are confident that they will benefit from this program.
Okay, I am Dr. Kelly Emelis Woodine. I'm a general practitioner. Like we all know, this is the creeks. We are in the creeks, and we are more in the riverine areas. We are more prone to more common ailments, communicable diseases, and the likes of infectious diseases like malaria, acute watery diarrhea. Those are the main conditions we have around here. But basically, all boils down to worm infestation, malaria symptoms, diarrhea diseases. Those are generally. But more in the elderly, you will also see cases of elevated blood pressure because of lack of education or lack of knowledge of what high anti-elevated blood pressure is. So this outreach gives us the avenue to educate people more about hypertension and diabetes and to clear some misconceptions about that, and also take this avenue, this outreach as an avenue to help deliver quality health care by by administering both anti-malaria medications as well as provision of insecticide-treated nets as made available
For
by
the
the
George Mangibo
foundation.
Reach Out Foundation, this was more than outreach. It was a promise kept. A promise to reach the forgotten, to stand in the gap, to give freely, because we can. The idea was born from a woman who once dreamed of making a difference. Her dream walked in with every doctor and spoke in every act of kindness.
It's not been easy organizing a program. As we all know, anything that has to do with organization, to organize an event or a program involves a lot of stress, a lot of energy, time, and dedication. So I really invested a lot of my time, my service, everything. In fact, I'm really stressed, but I thank God that everything is a huge success. Yeah, it's really good. So it was really a very stressful period, but thank God everything now is worth being the stress because the people are happy and I'm also happy. So when you're happy, I'm happy. I just love to want to make people happy, want to make people smile, and want to make people feel that they are being cared for and somebody has them in mind. So that's why I just had in mind to like, what can I do for my people to like make them happy and make them have a sense of belonging in the community they belong to, and to make them feel that someone out there really cares about their well-being and their health. That's why I came up with this program to honor our father, Pagodin George, who passed away. Likely to, it will be a memory, a long-lasting memory in the heart of the people that we've done this outreach for. Involved the council, wrote to the council members to abreast on the program that we have. So it's not really a easy one. We need a lot of awareness campaign, awareness programs. By God's grace, today the people that came for the program is really encouraging. It shows that people really care about their health as well, because health is wealth. You know, when people are healthy, the society itself becomes a better place for us.
Because now, this place remembers what it means to be seen, to be helped, to be healed. This was just one outreach, but to many, it was everything. You can always join us in making a difference, touching lives positively from any part of the world.